Hello and welcome to On Point. I'm Gabriela Rodriguez. Prescription drug abuse is an ongoing epidemic in the U.S. The Centers for Disease Control and Prevention say prescription pain medications kill 15,000 people in the U.S. each year. But young people, who are often vulnerable to prescription drug abuse, don't necessarily take the problem seriously.
I think maybe because there's a false sense of safety with the prescription drugs than there would be with something that's like an illegal substance, even though taking the prescription drugs in that way would be illegal.
Well, Vicodin is like, let's get high. I mean, Vicodin, codeine, all of those wonderful prescription drugs that make you feel good all the time. Mm-hmm. So, I mean, people do use them because you get your wisdom teeth pulled and they give you like 12 Vicodin, but really you only need like 6 because you only need to take 1 a day. And so you have 6 left and then you sell those 6 to your friends.
My roommate just threw me one. I don't know, it was kind of like a Tylenol thing. It's like, oh yeah, you want Adderall? Yeah, I got one. I think when you take Adderall, you can sit down and focus on something and get work done. Now, I've only done Adderall once, and I did it when I was halfway through my work. And when it kicked in, I was done with all my work, and I just ended up just dancing to music for like 2 hours.
The Drug Enforcement Administration says the most common prescription drugs used are OxyContin and Vicodin, effective opioid painkillers that provide relief for patients. Dr. Ernest Rossetti calls opioid abuse an equal opportunity addiction that is prevalent across all demographics.
You see it actually affect people from a wide range of socioeconomic backgrounds, people who are pretty disadvantaged, poor, if you will, to more affluent, wealthier individuals. It seems to touch upon all sectors of society pretty equally. In opiate withdrawal, you'll see people experience severe nausea, deep sort of bone pain, muscle cramping with muscle spasm, hence the term kicking. Sometimes people refer to it that way. Drooling, nausea, vomiting, severe diarrhea, cold sweats, inability to sleep, and this can actually go on for days, in some cases even weeks.
The prescription drug abuse crisis has led to increased crime and crowded prisons. The Los Angeles Times says it cost nearly $1.5 billion to treat patients in 2010. The Obama administration recently passed a regulation allowing medical facilities to collect unused prescription drugs. On Point Stephanie Murguia has more on the story.
Thank you, Gabby. Joining us today is Dr. Stan Galperson, who is a director of the residential and outpatient programs at Tarzana Treatment Centers, and Allie, who has been clean and sober for 5.5 years. Thank you for joining us today, everyone.
Our pleasure.
Thank you for having us.
So I want to get straight to the point and start with Allie. Tell us about when your addiction began and what drugs led you to that.
Well, I was about 13. I have an older brother who also suffers from addiction, and my first introduction to it all was marijuana, and then I went into prescription pills, and my mom actually had a drawer, and a lot of parents have this. A lot of kids that I talk to now have parents that just have pills in their medicine cabinets, and they don't really know the effects that has on kids, and that it's just so easy to just go in and grab. And that was really where it started for me, just eating handfuls, and it didn't smell, and it didn't, do anything. You just took them and you felt the effect. So that's what I chased always. So.
What prescription drugs were those?
It started with Vicodin and Somas and Norcos, and really anything I could get my hands on, but those were the main 3 that, did it for me, so.
Wow. And with that, doctor, what factors affect vulnerability to drug abuse and addiction?
There's several. People used to think it was strictly people were genetically predisposed towards addiction, and that's partially true. If you have a parent who's an addict or alcoholic, you have about a 50% better chance of becoming an addict or alcoholic yourself. But then, over the years, we've seen more about the links between mental illness and addiction, and perhaps a person is genetically predisposed towards depression, and so they seek out a stimulant drug to self-medicate, not realizing they're depressed. They just know they feel better. Or maybe they have a lot of anxiety, so they choose a depressant drug like alcohol or benzodiazepines, Xanax, like you were saying. and et cetera. What's really great about what we call opiate analgesics and the prescriptions we're discussing today is it helps you not feel. So if you've had trauma, you're just uncomfortable in your own skin, that sort of thing, it helps kind of self-medicate away uncomfortable emotional states, that sort of thing, and you adapt to it. And of course, if you're using it for that purpose, then you use more and more over a period of time till you develop a tolerance, and then you stop taking it suddenly, you have withdrawals, and then you use some more to overcome the withdrawals, and you have this whole addictive cycle going, and it doesn't lead anywhere good.
So there's not a one kind of personality that you have a bigger chance of.
Well, I would say, I've always felt that, one's personality sort of, if you're going to get into substance use disorders, or it's not like it's a choice, but if you are going to be predisposed towards that, I think it's more your personality that dictates the drugs you choose to use as opposed to, using drugs, period. Like I said, if you tend to be more anxious, you would choose something that's more sedating, and if you tend to be more depressed, you use, cocaine or methamphetamine, and if it's just about checking out and not feeling at all, well, opiate analgesics are a really good choice for that,
And what is it that makes these drugs so addicting?
They alter your brain chemistry, and they alter your brain, that's how, the drugs themselves is not what gets you high, it's the manipulation that takes place on a neuronal level in the brain. But what happens is after, months and years of abuse is you alter your brain chemistry. And so now you are depleted in certain neurotransmitters, and using the drugs helps you feel normal again. And so it just becomes a vicious cycle. It's really hard to break.
And if these drugs are so addicting, we know what they do to the human body, why are doctors over-prescribing this so often?
You must remember, with prescription medications, they do have legitimate uses. I mean, where would we be without analgesia, without pain relief? I mean, you'd go, under the knife in surgery, and you come out and you just take a couple aspirin. I don't think so. Tooth pain, what have you, they all have legitimate purposes, but the potential for abuse is pretty high.
Yeah. And going back to the personality and genetics, for example, my mom always says to me, you have the alcoholic gene, Stephanie. Remember that. When you're going out and drinking, your grandpa's an alcoholic, this and that. Is that, so you said that's a thing, you have a 50% chance if you have it in the family?
Yeah, you have a 50% better chance for each alcoholic or addict parent you have than the general population. I have two daughters. One is in recovery, and the other experimented. She's sophomore in college. She experimented as we do, and but she had a bad experience with it and went completely the other way. So again, one did, one didn't. I mean,
That's
we have exactly, perfect.
Can you connect with this?
Yeah, I mean, I have alcoholism running in my family, a lot of it, but I think my personality, like he was saying, my personality is I do things extreme, so I go one way or I don't do it at all. And that was where my drug addiction took me. It took me all the way, and the stuffing of the feelings, and I just didn't want to feel anything, and I think that's something that a lot of young people do suffer with, so.
Yeah.
The other thing to keep in mind, and I know it's off topic a little bit, but addiction takes many forms. It doesn't need to just be chemicals. It can be food, it can be sex, it can be any obsessive compulsive behavior can become potentially addictive. And so people use all kinds of different things to, stuff those, what you was describing, stuff the feelings, escape, what have you, so.
Yeah, I mean, I feel like I have an addictive personality, and then with my mom stuffing all these things in my brain, saying, you know what, look at this. You have an addictive gene in you. So you do rethink about the choices that you make because of the things that are out there.
The things your mother told you, that's very good advice, actually, because, drugs and alcohol don't come with warning labels. And, if you have XYZ, you're particularly at risk. So that's good information to have.
Yeah. Think about that, parents.
For instance, my dad actually has the addictive personality.
Yeah.
He just has never drank or done a drug in his life, but he has that same, the same behaviors that all addicts and alcoholics have that I know, so.
Were people around you noticing that there was something wrong?
No.
So you were able to keep that pretty hidden?
Well, I thought I was hiding it, but at the end, it came out. I lost a lot of weight, my hair was falling out, my skin was yellow. I didn't think anything was wrong, but people around me started to, what's going on with her, so.
So do we have any common symptoms of drug addicts? Are they obvious, like you said? Do they come at the end of, or, you know, when you're hitting rock bottom? Is that when they're more obvious, or is there some other common types?
Clearly, there's a progression, and the physical effects vary drug to drug. You know, alcoholics will present this way, heroin addicts another way, stimulant addicts another way. You know, I had one patient, by the time he got to treatment, he weighed 108 pounds, and this was a 7-foot person and normally weighs 170. A 6-foot person, rather. But, you know, it would vary.
But with prescription drugs, though, is it easier to hide it when you're...
Oh, sure. It's like you were saying. They don't smell. They don't. There's no odor in the air like smoking marijuana. There's, you know, it's very easy to keep it undercover. I mean, you may start slurring a little bit, and you're not very clear, and you could stagger if you're taking a lot. But, you know, well, I'm tired, or, you know, I had a bad night, or, you know, whatever. There's 80 million ways to rationalize why you're coming across the way you are. You know.
Yeah. So, like you said, your health was affected. What are the like your hair? Is there anything else that you could tell? Or did you even think about that kind of stuff?
Honestly, I didn't really care. I got to a point, and it's really sad actually, I got to a point where I no longer wanted to be alive. You know, I couldn't even look at myself in the mirror anymore, and the only thing I knew how to do, the only solution I had was to take drugs or drink alcohol to not feel. You know, I numbed myself out because I didn't know how to deal with life on a daily basis. I had everything I learned as a child went out the window, you know, and it was hard.
When did you know that you needed to go get help?
You know, it's funny, I actually knew the second that I started using drugs that I knew that I was going to be sober one day or die. Oh, wow. And I thought that I could control it for a long time. And, you know, I knew my older brother, he had, you know, he was taking about 50 Vicodin a day when he got sober at the end. And, you know, I knew that I would be here one day. I just didn't realize how young I would be when I would actually finally realize that I was dying.
And you were 20?
I was 19 when I got sober.
Mm-hmm. And then what did you do? What were the steps that you took?
Well, I called my dad, and I was in college, and I called my dad one day and I said, I need help. It was very manipulative. It was because people were starting to realize what was going on, and I wanted to get the heat off my back. And so in the beginning, I had no intention of staying sober. I didn't want to stay sober. I didn't think that I could. I was just, you know, doing what I needed to do to get everyone off of me, you know, worrying about me. I didn't want people to worry. And so I called my dad and I asked him for help. And I thought I was going to get to go to rehab where my brother went. He went to rehab in Malibu, and I didn't go through rehab. I didn't go through a hospital. I didn't have to do any of that. I went to a 12-step program, and I asked for help, and I asked people that had been sober for a long time, you know, what they're doing on a daily basis to stay sober. And that's what I did, and that's what I continue to do still on a daily basis. I have to.
And not everybody goes through rehab.
Yeah.
It's not always necessary. I mean, and that's awesome, you know, that you were able to do it that way. And I really commend you for that. That's awesome.
It's pretty crazy.
Yeah.
It's pretty amazing.
Yeah.
Speaking of treatments, a lot of rehab facilities use the methadone program for, I hear specifically for heroin addicts, or they do the good old quitting cold turkey method. Can you tell us of the dangers of quitting cold turkey for prescription drugs?
Well, first of all, I'll say there's very, very few that I'm aware of that do detox medication free. For one thing, most people that they do some kind of medication regimen. Now at Tarzana, we do use methadone for detox. There's several reasons for that. Methadone is a good drug. It handles all the symptomatology associated with opiate detox. Rather than giving 5 different medications, you give one. And you can use it's a liquid, so you can give it in decreasing doses over a 7 to 14 day period and bring a person down really softly and nicely where they're very comfortable. And that's essential, because when they start feeling withdrawal symptoms, and with narcotic analgesics, it's body aches, it's stomach upset, it's headaches, it's elevated blood pressure. It's not a fun ride. It will not kill you, but you're going to feel like you want to die.
Yeah.
Okay, whereas like with alcohol, you could have a seizure and die. With benzodiazepines, you could have a seizure and die. Stimulants, withdrawal's not going to kill you. You're going to be depressed. You're going to sleep. You're going to eat like a horse. But other than that, you're going to be okay after a few days. Okay. But with the narcotics, it's a tough detox, if done unsupervised and on your own. And most people don't do it. They can't do it. They need some assistance to do that.
Yeah. What were your withdrawals? Yeah.
I actually, my withdrawals weren't all that bad. I wasn't sleeping. I didn't sleep for about 3 weeks, and I was hot and sweaty, and I didn't really feel, I felt physical pain, but it was more emotional than anything. Like, I'm never gonna get to use anything to numb myself out anymore. And I see a lot of people that don't go through programs to detox, and they just surround themselves with people, and it's hard. Like, people want to die. They think that they're dying. They they want to get loaded. They want to do all of these things, and it's been my experience that I needed to remember how bad it was. Yeah. And I wanted to remember that I never want to go through that again. I never want to feel that way ever again. But I had a question for you. What do you think about Suboxone? What's the difference? Why do you guys use methadone and not?
Well, we use both.
Oh, you do?
That's one way we do it. But we usually will assess a person if they've been successful with the methadone detox before, because not everybody gets it the first time. In fact, very, very few, about 10%, get clean and stay that way. But we'll offer Suboxone if that's been successful in the past. If methadone hasn't been successful in the past, let's try something different. We'll do Suboxone. Similar kind of thing. Blocks the receptors in the brain from receiving the withdrawal signals that are causing the discomfort, and et cetera. And you taper them down over several days and bring them down nice and easy, and then they're ready to start doing the more psychosocial aspects of recovery, like group therapy and individual therapy and so on and so forth. There are those people, though, that have a chronic pain condition, and how are you going to address that? There are other people that, they're not really interested in being abstinent completely from everything, but they're doing a lot of the things they're not very proud of in order to maintain their habits. So that we have a thing called methadone maintenance for that. It's about harm reduction. If I can bring you up to a level of functioning by just helping you with the withdrawal symptoms, but you're doing methadone every day, and that's okay, but you're not committing crimes anymore. You can hold down a job. You can be a responsible member of your family. We've reduced the impact it's having on your life. It's not ideal. It's not for everybody. But when I see people coming through again and again, and they're on their 10th detox episode, it's time to say, let's do something different. Are you really, interested in being completely clean and sober, or would this be a viable alternative for you? And for a lot of people, it is. Like I said, chronic pain patients, they're going to have to take something. Methadone has the benefit, it doesn't get you high, it just manages the pain and keeps you from going into withdrawal. So, I've become a strong proponent of that. Something else, if I could. Overdose is a huge problem in our country today.
Yeah.
Something we're taking some initiative. There's been some laws passed lately that make it legal for a normal person to possess a medication called Narcan. Narcan will instantly stop the effects of a heroin or opiate overdose. So civilians like us can now get a prescription for it, keep it in your glove compartment, and have it ready if your friend or you are having an overdose, and you can stop it.
Like in Pulp Fiction? Not as Hollywood.
No, that's exactly right. That was adrenaline, but that's exactly the same concept. And we're developing some programs right now where anybody who wants to, when they leave treatment, can get a prescription, can have it with them in case them or their friends get into trouble. It's not setting people up for relapse, it's just being realistic that people are going to relapse. It's just a fact of life.
It's a 40 to 60% chance.
Exactly. And we're about saving lives.
Yeah.
So.
And speaking of relapse, do you ever think about that? Like, how do you feel about that rate? And have you seen any friends of yours or people that, relapse fairly easy?
I personally had a stint of 6 months sobriety when I was 18, and a series of events happened that I ended up relapsing because I had no defense. They talk about it in the 12-step program. There's no defense against that first drink or that first drug. When I make a decision in my head because of the personality that I have, the addictive personality, I'm off and running. There's no stopping. You can't stop me. Nobody can stop me. The difference between then and now is that I still have that thought. There are days when I wake up and I think to myself, it would be really nice to have a glass of wine or take a pill, you know, to not feel this uncomfortableness that I'm feeling.
Do you take aspirin or anything like that?
You know what? I try really hard not to. I try really, really hard not to. I had my wisdom teeth out earlier this year, and I didn't take anything, not a thing.
Wow.
And I was in pain, but I know myself now that I don't trust myself even taking an aspirin because I know what a Vicodin is going to do to me.
Yeah.
You know, I think that. I mean, obviously when people have headaches and migraines and that kind of thing, of course that's, you know, I have done that, and but I'm very stubborn when it comes to taking anything because I just don't want to deal with it.
You know, and that's choice you made.
Mm-hmm.
And, you know, but I want to point out to our viewers that, you know, just because you're in recovery doesn't mean you forego the right to seek, you know, comfort through legitimately prescribed medication.
Mm-hmm.
You know, we don't want to give people the wrong idea, but, you know, the strategies you can employ, like, you know, give it to a friend to hold and just give it to me every 4 hours like it says, and then we're gonna flush it at the end of 3 days, that kind of thing. You know, there's ways around it because we can't trust ourselves with that, you know, that demon in your hand. You know, it's really tempting.
So why do people relapse?
Well, you know, when you can feel this as well as I can, you know, that people tend to get away from their recovery program. They give up their support group, they start finding other priorities in their life, be it a relationship, a job. I'm just too busy at work to get to a meeting tonight. And they just kind of chip away at that foundation that they've built. And the next thing you know, something comes up, you break up with the boyfriend, or, you know, you have a bad day at work with the boss or something like that, and you're feeling that emotional pain. And you've lost that support, you've lost that foundation, and, you know, those thoughts start running through your head about, gee, a Vicodin would take it away. Did you smoke a quick joint? I never had a problem with pot, by the way.
Right.
It was just a Vicodin.
Right.
So I'll rationalize why it's okay to do that or have a beer or something like that. But you know what? You do that, and then you're smoking the pot, and then you're doing the Vicodin. It's just one, because you impair your judgment.
Yeah.
So it just sounds like a really good idea, and I'll just take one, right?
Yeah.
Well, we can't take just one.
Never.
And I say we, I'm in recovery many years myself. That's how I came to do what I do.
Right.
But, you know, I know that demon is alive and well in Stan, you know,
really
in the
is
back
just
of my
hard to
brain.
solve.
It's like that cartoon, you know, with the little devil on the one thing and the little angel, no, don't do it. You know what's going to happen. Oh, no, come on, don't listen to her, you know.
One can be more powerful than the other.
And it's
always the devil.
I see it every day. I
Yeah.
work with a lot of, especially young people, because I am a young person who's sober, but I see a lot of young people get sober and they start getting their lives back, and stuff starts happening, and getting a job and getting a relationship, and they feel good about themselves, and then they forget. That's why I said, you know, I have to remember personally how bad that feeling was when I got off of everything, you know, and I never want to go through that ever again, you know, and that's the experience that we have to share, you know, with others, because, you know, forgetting where you come from is something that happens on a daily basis. There are a lot of people out there that, oh, you know, I think to myself, why can't I just have a glass of wine with my mom? And now my head goes, that glass of wine is going to take you to this, and this, and then eventually you're going to be shooting heroin on the street.
Yeah.
And, you know, that's where it takes us.
It's a very important point. You know, I tell patients all the time, like on their first day, they come in, they're dragging, they look like hell.
Yeah.
And they feel awful. And I'll say, you know, maybe it's the second or third time through and they've relapsed and we have some history. And I'll say, I want you to think about how bad you feel right now and know that you never have to feel this way again, but it's going to take some work.
Yeah.
But I never want you to forget this moment. And sometimes that works, you know?
So think about where we are now in terms of legislation.
Yeah.
Prop 46, part of Prop 46 talks about requiring health practitioners to consult their state prescription drug history database before prescribing certain controlled substances. Do you think this is a good thing?
That part of the bill I like because addicts and alcoholics were very manipulative people. So it's nothing to go from one doctor and get a prescription and go across the street to another doctor and get a prescription and so on and so forth. If my doctor knows I'm already being prescribed over here, he's not going to, so it would limit access. So that's kind of a part of it. I think that's smart. And we have the technology to do it. We should go ahead and do it.
Good. And just to wrap up, is there a way to prevent this from happening, preventing addiction?
Well, you know, I could get on a soapbox and talk for hours about this.
Yeah.
I really could. The
There's
war on
no
drugs
list of instructions.
Well, I'll tell you, the way we're doing it now is dead wrong. I mean, our whole drug control policy, and that's what they call it, is all based around interdiction, punishment, incarceration. And it's not a law enforcement problem. It's a public health problem.
Yeah.
We are, sick people who need help, and rather than throw a person in prison for however long, we need treatment. And that's, it's supply side rather than demand side. For every person we successfully treat, for every person who successfully gets clean through a 12-step program, that's one less person that's there to purchase, to consume. You're never going to cut off the supply of drugs in this country. It's never going to happen. Yeah. But if you could decrease the demand, that's a good start.
And I think also having an open discussion with family members or support groups on campus at schools and that kind of thing. I think, not punishing, but having an open dialogue with people about why are you using drugs, or I don't think it's ever going to be stopped. Like I spoke at this thing a couple weeks ago, and these parents, were asking me, do you think if your parents had done something differently, would it have, your outcome, would it have been different? And I said, no, but I could have not hit it so early on, maybe. I don't really know. But I think people do have that. I think it's a genetic thing. I think it goes back to genetics, and it's an addictive personality. And I think having an open dialogue and having support groups out there and having people to reach their hand out and help in any way that they can in treatment centers and that kind of thing, I think that is really important and crucial. So,
well, thank you both for joining us. This is great. I hope somebody out there learned something. Thanks, everyone. Again.
Thank you.
Enroll, we say. We want you to be okay. Enroll, we say. Take care, people, for goodness sake. There's a plan for every budget, so don't accept defeat. Now you can get covered and still buy me treats.
You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
In the small town of Elmira, New York, a boy was born into an all-American family. The odds of him achieving his dream in the fashion industry? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 68. I am Tommy Hilfiger, and my family is affected by autism. Learn more at autismspeaks.org/signs.
Thank you for watching On Point. You can follow us on Facebook or Twitter at CSUN On Point. You can watch us on LA Channel 36 on Saturday mornings at 8:30 and Sunday mornings at 11:30. You can hear us on KCSN FM 88.5 Sunday mornings at 5:30. For all of us here on Point, I'm Gabriela Rodriguez.